Yeah, I am Dr. Ajit Bana. I am working as the chairman of cardiac sciences at Eternal Hospital, Jaipur. I am a cardiac surgeon as well as I am working with cardiologists in various intervention procedures or in hybrid procedures. So let's talk about first of all the aortic diseases. Aortic diseases which are involving the main artery which is known as the aorta. They can be aneurysm, dilatation of aorta, or it can be a rupture of aorta. So the common problems are either a dilatation or a rupture. So they usually occur either there is a problem since birth which lead to the thinning of the arterial wall and which lead to the dilatation, or it can be sudden variation in blood pressure, it can be aging or sometimes in pregnancy which lead to variation in blood pressure and rupture of the aorta. So these all pathologies like either a aneurysm or a rupture, they are very complex disease, and if they are not treated in time, patients usually don't survive. So whenever somebody has a diagnosis of either aortic aneurysm or aortic dissection or rupture of aorta, they should contact the doctor immediately, and the treatment for these diseases is only surgery. No medicine works for these diseases. The surgeries has various types. The most important to understand this, that these diseases are very complex and they cannot be treated by individual surgeon or a cardiologist or a physician. They need a team approach which is known as heart team. So in team approach, the cardiologist, anesthetist and surgeon, all three mix, decide the treatment protocol, and then there is a part surgery and part intervention and a complex anesthesia. And if we combine all three together, then definitely patients' outcome are, even in these serious diseases, are very good. And we are very proud to announce that we are one of the leading center of complex aortic surgery in Rajasthan. We do all type of aortic surgeries, either aneurysm or dissection or rupture of aorta, and do all hybrids, all aneurysm surgeries and all type of replacement and repairs of aortic diseases. Aortic diseases are quite complex, and because there are combination of treatment like surgery plus intervention, the patient sometimes need to stay for 12 to 14 days in hospital, and patient come back to normal life in maybe about 6 to 8 weeks time, and after that they can lead to almost their routine activity. But most importantly, the patients need to be in regular follow-up with the doctor. They need to take medicine for a longer time. They need to control their blood pressure. Exercise program is very gradual, and they can start their regular exercise maybe after 3 months. The diet restrictions are very limited, but definitely whenever patient discharged, we give them a proper diet protocol. Drugs initially are a little higher. As the time passes on, patient is on 2 to 3 drugs only. As we know, every patient in surgery, they should have a less pain, as well as their incision, their scar should not be visible. So in gallbladder surgeries, in other surgeries, the minimally invasive surgery has been in there for last 10-15 years. But in cardiac surgery, heart surgery also, the patient is demanding a lesser incision size, less pain, and maybe sometimes the incision should not be visible. So that sort of surgeries are known as minimally invasive cardiac surgery. These surgeries, the diseases which can be treated by these surgeries are aortic valve replacement, mitral valve repair or replacement, and we can fix the hole in heart like atrial septal defects. And bypass surgery can also be done through a very small incision. These minimally invasive surgery, if done from the right side of chest, means for the mitral valve on ASD, then the scar is almost not visible. And if done on the left side, then the scar is very, very small. Minimally invasive cardiac surgery is important because there is less pain. Patient start moving early. Hospital stays only 4 to 5 days. Patient go to his normal work maybe in 2 weeks time. Whereas in the other conventional surgery, patient takes about 4 to 6 weeks to regain their normal activity. Minimally invasive cardiac surgery is quite oftenly performed at Eternal Hospital with excellent results, and we have done almost all type of complex surgeries through a small incision. The drugs after these surgeries are little higher to start with, as I told you, and gradually these drugs will come down to low or maybe 2 or 3 drugs only. Because there is a less pain, the incision is small, patient's activity, routine exercise program is maximum in 4 weeks time. The routine diet protocols need to be followed as given by the patient at the time of discharge, to the patient at the time of discharge. Aortic valve, as we know, is a very important valve which is on the left side of heart. And whenever either it gets shrink or it gets dilated, it leads to the problem on left side of ventricle, left side of heart. Patient started having breathing difficulty. Sometimes there is a vertigo. Patient have weakness, and these aortic valve diseases can be lethal. There is no medical treatment for any aortic valve disease. If anybody has either a shrinkage of aortic valve or a dilatation of aortic valve, they need to consult a doctor, and the treatment is only surgery. Then routinely, maybe a few years back, what we used to do, we used to cut all the valve, disease valve, and put multiple stitches to replace a new valve. But because this putting a multiple valve sutures take a lot of time, so the technology has advanced further, and now there is a treatment available which is known as a sutureless aortic valve replacement. In this, we make a small incision onto the aorta, cut all disease valves. We do not need to take any stitch onto the aorta and just size the valve and implant it. It can be done in hardly 5 to 10 minutes, whereas the conventional aortic valve replacement used to take sometimes 45 minutes to 1 hour. So the sutureless aortic valve technology has given a new dimensions to aortic valve replacement. And now aortic valve replacement can also be performed in high risk patients because it will take less time, as well as the function of valve are very good in this. So sutureless aortic valve technique is available at Eternal Hospital, and we are the only hospital in Rajasthan which performs sutureless aortic valve replacement through a very small incision on the right side of chest. Patient usually go home early, the drugs are very less, pain is very less, and mobilization is quite quick. Layman thinks that the heart failure is stopping of heart, whereas it is not. Heart failure is when the heart is not able to pump the sufficient amount of blood which is required by the body. It means, by all doctors says, then this heart is not able to fulfill the demand of the body and it is failing to do its duty. That is known as heart failure. So any patient can develop, but if somebody has a heart failure, there are various causes. It can be because of the heart attack, it can be because of the disease in the valves, or it can be because of disease in the muscles. Any of these involvement can lead to dilatation of heart becomes quite big, and heart pumping got less, got affected, and heart pumping get less. When the heart start showing lesser and lesser pumping, then we call the patient is having a heart failure. Any patient who is having a heart failure, initially we try to treat them with drugs, exercise, there are various drug protocols, as well as restricting the lifestyle, restricting the salt intake, restricting the water intake. Or if there is any disease which can be corrected by surgically, we try to correct that disease so that the heart failure at least stop or may sometimes